Introduction. Essential Families, the Amazon for Social Services and Economic Development. Essential Families is a 100% data and AI driven 501c3 nonprofit founded in 2020 and headquartered in Kansas City, Missouri. Our mission is to close the digital divide and enable economic mobility for low income families through integrated wraparound services delivered directly to their homes. Since inception, Essential Families has served 1,060 families, achieving this impact on a limited budget through highly efficient, technology-driven service delivery. This work is led through the Essential Economic Mobility Program, which integrates the Urban Institute's Upward Mobility Framework with targeted economic mobility interventions, essential telehealth, and essential parenting services, all delivered 24/7 to families' homes, operating as the Amazon for Social Services and Economic Mobility. Essential Telehealth, provided through Essential Families, is an approved Missouri Medicaid MO HealthNet clinic provider and offers 24/7, 365 access to board-certified physicians and licensed mental health professionals via phone and secure video for primary care, urgent non-emergency needs, and behavioral health support. Families can receive diagnosis, treatment plans, and appropriate prescriptions for common conditions, as well as ongoing telebehavioral health care, ensuring that critical medical and mental health services are accessible from home and tightly integrated with Essential Families' broader economic mobility supports. Our economic mobility workshops hold a 4.9 client satisfaction rating, and our digital case manager follow-up services maintain a 4.8 rating out of 5, reflecting high trust and value among participating families. Independent validation from UMKC's Dr. Brent Never confirms measurable outcomes across all 5 pillars of upward mobility defined by the Urban Institute, demonstrating that even with limited resources, this model delivers meaningful and quantifiable improvements in families' lives. Essential Families is requesting $50,000 to serve 14 Lexington, Missouri households with the Essential Economic Mobility Program, digital access, plus wraparound health and stability supports. Align to the Urban Institute Upward Mobility Framework, economic success, power and autonomy, and dignity and belonging. We will track household stability, employment, housing security, digital access, and health access through monthly KPI cycles, with progress reports available in near real time to the Lexington Health and Wellness Committee. This $50,000 investment generates a quantifiable community ROI in year 1. Using the community ROI model, the estimated annual community value for 14 households is $280,000. Household stability, $33,600. Education access, $50,400. Employment/income growth, $119,000. Healthcare outcomes, $25,200. Crime reduction, $16,800. Small business development, $35,000, plus incremental tax revenue as participant earnings rise. That equates to approximately 560% year 1 ROI and an estimated approximately $1.40 million in community value over 5 years, before including tax revenue. Tax revenue is conservatively estimated using an effective combined local sales/income tax proxy. Final tax projection can be refined with Lexington's preferred local methodology. Lexington residents living at or below 150% of the federal poverty level, FPL, including seniors, parents of school-aged children, and underemployed adults, experience a compounding barrier: limited digital access blocks, healthcare, telehealth, education, and workforce participation. The result is delayed care, unmanaged chronic/behavioral health needs, reduced employment options, and preventable household crises. Essential Families currently has 7 qualified households waiting for services, demonstrating immediate demand. This proposal directly advances Lexington's stated priority to improve the overall health and wellness of the citizens of Lexington across physical, mental, and social well-being, using our proven 24 steps to close the digital divide delivery system, digital case manager wraparound supports, essential telehealth, and parenting education. We will deliver practical tools, broadband plus devices plus skills, that unlock sustained wellness, measured through the Economic Mobility Index approach, time to recoup training costs and improved income rank, and 5-year longitudinal tracking. Problem statement. Essential Families is requesting $50,000 to serve 14 households in Lexington, Missouri, prioritizing residents at or below 150% of the federal poverty level by removing digital access and stability barriers that prevent families from achieving health, wellness, and upward mobility. In Lafayette County and similar rural Missouri communities, households experiencing low income face overlapping barriers measured in the Urban Institute's upward mobility predictors: limited earnings, constrained employment options, lower educational attainment, housing cost burden, and reduced access to preventative health care. For Lexington specifically, a conservative planning assumption, estimated from regional rural Missouri averages, is that 20 to 30% of households are cost burdened, 8 to 12% lack health insurance at some point during the year, and 15 to 25% of households lack reliable broadband and slash or a functional computer device, gaps that disproportionately impact seniors on fixed incomes, single-parent households, and residents with disabilities. These barriers are not isolated. Without a device, skills, and stable connectivity, residents cannot consistently access telehealth, apply for jobs, complete training, support student learning, or navigate benefits and local services. Cost of inaction is measurable. When families cannot access preventative care and behavioral health supports, they rely on higher-cost urgent and emergency care. When residents cannot access employment pathways, local purchasing power and tax contributions stagnate. Even a modest, attainable wage gain, for example, $5,000 to $8,000 annually per household through improved job access and retention, creates meaningful local fiscal benefit while reducing avoidable public costs tied to crisis care, housing instability, and family stress. Digital access is the gateway predictor that unlocks all 5 Urban Institute pillars: rewarding work, remote/hybrid jobs, education, online learning, opportunity-rich neighborhoods, resource navigation, healthcare, telehealth, and responsive governance, digital access to public systems. With 7 qualified households currently waiting, Lexington has immediate demand for an intervention that improves wellness by making healthcare access, parenting education, and economic stability possible, starting at home. How we strategically align with your objectives. Essential Families request $50,000 to serve 14 households in Lexington, Missouri, by improving the overall health and wellness of a significant number of Lexington residents through home-based digital access, telehealth, and wraparound stabilization supports. Our work advances upward mobility as defined by the Urban Institute, economic success, power and autonomy, and dignity and belonging, by removing barriers that keep families from accessing care, education, and employment. Strategically, the Essential Economic Mobility Program aligns to the Committee's definition of wellness as holistic, physical, mental, and social well-being. Our model directly activates the Urban Institute's 5 pillars. 1. Rewarding work through digital workforce pathways and job readiness. 2. High-quality education through digital skills training and parent education. 3. Opportunity-rich neighborhoods, by connecting households to local resources and services. 4. Healthy environment/healthcare through unlimited primary care, telehealth, and up to 5 mental health sessions without wait lists. And 5. Responsive governance by building a transparent, measurable, and reportable service system that demonstrates what works. Innovation and differentiation. Essential Families operates as the Amazon for social services, a data and AI-enabled delivery model that pairs in-person enrollment with high-touch virtual follow-up via no-W video, with real-time translation into 130 languages, and a trained digital case manager. Our proprietary 24 Steps to Close the Digital Divide includes weekly quality assurance testing, continuous monitoring, and near real-time reporting, so the committee can fund outcomes, not activity. Systemic impact is measurable and investable. For 14 households, the Year 1 Community ROI is estimated at approximately $280,000 in combined value across stability, education, employment, health, safety, and small business development, approximately 560% ROI on a $50,000 investment, with additional local tax benefits as wages increase. Outcomes are tracked through an economic mobility index lens: wage growth, career progression, time to recoup costs, and workforce indicators aligned to American Opportunity Index concepts: entry access, wage competitiveness, advancement velocity, retention. Workforce development ecosystem, AI-enabled, and partner collaborations. After households achieve stability through Essential Families' Economic Mobility Program, our AI agent Carrie triages each client's goals, barriers, and readiness, then connects them to the best fit workforce partner, Full Employment Council, Great Jobs KC, P/Strata, RW2, Cybersecurity, or Operation Breakthrough, while keeping every partner and participant in the same accountability loop with real-time progress reporting mapped to the Urban Institute pillars. P/Strata is emphasized in this ecosystem because it offers comprehensive, stackable skill building and coaching, from foundational office/administrative and professional readiness skills to advanced professional competencies, delivered through blended and online learning options, plus organizational development, leadership development, supervisor/team development, diversity training, and management consulting supported by coaching and mentoring. Importantly, for economic mobility in smaller communities, P/Strata also supports entrepreneurship by helping individuals identify viable business ideas, build core small business capabilities, operations, customer development, budgeting/cash flow, marketing, and systems, and access the training and guidance needed to start and run a business, positioning participants not only as employees, but also as entrepreneurs and small business owners within the regional economy. In parallel, Full Employment Council provides employment navigation and connections to training and hiring networks, job readiness, placement support, and barrier removal services. Great Jobs KC supports access to tuition-free/low-cost training pathways for in-demand careers with coaching and completion support, RW2. Cybersecurity offers cybersecurity-oriented training and career exposure aligned to industry needs. And Operation Breakthrough strengthens workforce readiness for parents by pairing early childhood supports with family-centered services that remove childcare and stability barriers, together creating a seamless, AI-coordinated pathway from stability to credentials to employment retention, measured continuously in the Carrie system for transparent performance management. Addressing the questions. Question 1. Explain the need for the project. Answer. Lexington residents at or below 150% FPL face a compounding health and wellness barrier. The digital divide blocks access to health care, including telehealth, health information, employment, education, and local resources that stabilize households. Without a reliable device, broadband, and basic digital skills, residents delay primary care and behavioral health support, struggle to manage benefits and appointments, and lose access to higher wage work opportunities, driving avoidable crises that reduce physical health, mental health, and social connectedness. Essential Families has 7 qualified households already waiting, demonstrating immediate unmet need. This project addresses wellness at the root by making healthcare access and stability possible at home, and measuring results through monthly KP is aligned to the Urban Institute's Upward Mobility Framework. Question 2. Outline the steps and the people involved in developing and implementing the project. Answer: Essential Families will implement the project over 12 months using our 24 steps to close the digital divide methodology. People involved include 1. Project Lead/Authorized Representative, Jennifer Cohen, Director of Rural Economic Mobility Program. 2. Essential Families Program Operations and Data Team, Intake, Device Provisioning, KPI Reporting. 3. Trained Digital Case Managers, local recruitment/training supported by our existing 60 DCM network. And 4. Lexington referral/workshop partners, for example, city, health department, schools/library/community organizations supporting outreach and participant identification. Steps: months 1 to 2, partner onboarding, baseline assessments, DCM training, QA setup. Months 3 to 8 workshops, device distribution, ISP selection and enrollment, digital skills coaching, telehealth and parenting education activation, follow-ups. Months 1 to 12 ongoing QA, KPI tracking, quarterly progress updates, and final report with invoices for equipment purchased. Question 3. Include a project budget. Answer: total request $50,000, serving 14 households, approximately $3,571 per household. Budget line item: 1. Devices and support, Chromebooks plus 1-year premium support, $12,600. 14 devices times $900 fully loaded. Device, setup, premium support/warranty, protective case. 2. Internet access subsidy, 6 months no cost per household, $10,080. 14 households times $120 per month times 6 months. Average all-in cost including fees. Actuals vary by ISP. 3. Digital case manager services, intake, coaching, follow-ups up to 3 months. Referrals, $16,800. 14 households times $1,200. Time, travel for in-person as needed, documentation. 4. Essential telehealth access, primary care, plus mental health sessions administration/enablement, $5,600. 14 households times $400, platform/admin and activation support, clinical services delivered via licensed providers. 5. Parenting education, 12 weekly 90-minute sessions, materials and facilitation, $2,520. 14 households times $180. 6. Translation/video support, data and reporting, no W video enablement, KPI reporting, QA, $2,400. Total, $50,000. Cost reasonableness. The budget concentrates spending on direct household enablement, devices, connectivity, case management, telehealth activation, and includes QA and reporting required for accountability. Question 4. Describe your plan to sustain the project over time with ongoing maintenance requirements and costs. Answer: sustainability is built into both household-level continuity and organizational operations. For households, devices include 1-year premium support to reduce repair/replacement risk, and digital case managers transition families to the most affordable long-term internet plan after the initial 6-month subsidy while ensuring ACP/low-income equivalents or provider discounts are pursued when available. For essential telehealth, We maintain ongoing access through our negotiated service model and will prioritize continued enrollment for Lexington households as new funds are secured. For the organization, Essential Families sustains programs through diversified funding, local philanthropy, corporate partners, and public sector collaborations, plus technology-enabled efficiencies, No-W video, Everything KC resource navigation, that reduce per household service delivery cost over time. We will reapply quarterly as permitted, pursue additional regional health/wellness and rural broadband/digital equity funders, and leverage workforce partners via our Carry AI triage and referral model to move stabilized households into training/employment pathways, improving earned income and reducing long-term dependence on crisis supports. Question 5. Explain how you will evaluate and document the success of your project. Answer: we will evaluate success with a practical, KPI-driven framework aligned to the Urban Institute Upward Mobility Predictors and the Economic Mobility Index methodology. Baseline data is collected at intake, digital access, employment status, healthcare access, housing stability indicators, and goals. Process measures include workshop completion, device deployment, ISP activation, follow-up completion, and telehealth activation. Outcome measures include 1. Digital skills gains, pre/post assessment. 2. Healthcare access utilization, telehealth visits completed, time to appointment. 3. Employment progress, applications, interviews, job placement, wage changes where available. 4. Stability improvements, resource connections, reduced missed appointments, reduced crisis referrals. And 5. Satisfaction, target greater than or equal to 4.8/5. We will provide monthly KPI summaries, a final written report, and, if equipment is purchased with grant funds, copies of invoices/receipts as required. Question 6. Explain how you plan to provide public recognition of HCA Midwest donation to this project. Answer: Essential Families will provide visible public recognition consistent with committee guidance by 1. Applying the HCA Midwest Division logo, as provided, on any equipment purchased or on durable labels affixed to devices/carrying cases where appropriate. 2. Including written acknowledgement on participant-facing materials, workshop signage, and our website project page. And 3. Acknowledging HCA Midwest Division in any public communications about the Lexington Health and Wellness Project, press release/social media, coordinated with city preferences. We will submit proof of acknowledgement, photos/screenshots, with quarterly updates in the final report. Question 7. Provide any other information that might help the Health and Wellness Committee understand and evaluate your proposal. Answer: this project is intentionally designed to improve wellness without duplicating or competing with Lafayette Regional Health Center services. We are not proposing direct in-person medical services in conflict with the hospital. We are enabling access and navigation, especially telehealth access, primary care and mental health sessions, appointment adherence, and digital health literacy, so residents can obtain timely care through appropriate channels. Essential Families has demonstrated capacity, 1,060 families served since 2020, and high client satisfaction, 4.9/5 workshops, 4.8/5 follow-up services. The investment case is strong. For 14 households, the community ROI model estimates approximately $280,000 annual value, approximately 560% year one ROI, and approximately $1.40 million 5-year value before tax impacts. We welcome an in-person interview and will maintain proactive progress updates, including device/internet activation status and outcome dashboards. Question 8. Note: if applicable and grant is awarded, Copies of invoices for equipment purchased will be required. Answer: essential families will comply fully. We will maintain itemized purchase documentation for all equipment acquired with health and wellness funds and will submit copies of invoices/receipts with the final report and earlier upon request, consistent with City of Lexington requirements. Question: which dimension of wellness does this project propose to improve/promote? Answer: this project improves all three dimensions specified by the committee: physical health, access to primary care via telehealth, improved ability to schedule/follow-up, mental health, rapid access to secure mental telehealth sessions without wait lists, and social well-being, reduced isolation and increased connection to local services, workforce pathways, and multilingual support via No-W video. Question: how will this project benefit the residents of Lexington? How many individuals would benefit? Age ranges? Answer: the project benefits Lexington residents by making healthcare access, health information, education, and employment pathways reachable from home, reducing missed care, and increasing household stability. We will directly serve 14 households in year one. Assuming an average household size of approximately 2.5, estimated rural Missouri average, that is approximately 35 individuals benefiting. Age ranges include children and youth, 0 to 19, supported through parent education and improved digital learning access. Working age adults, 20 to 64, supported through telehealth, employment, and digital skills. And seniors, 65 plus, supported through digital navigation and telehealth access. Services are tailored to each household's needs, including additional in-person support for seniors when required. Question: can impact of project be measured or evaluated? Answer: yes. Impact is measurable through baseline to follow-up changes tracked monthly and summarized quarterly, device/broadband activation, training completion, telehealth utilization, employment steps and wage changes when available, and stability indicators. We also calculate community ROI annually and track economic mobility index measures such as wage progression and time to recoup costs, with 5-year longitudinal follow-up where feasible. Question: does this project duplicate any current projects in City of Lexington? Enhance any projects? How would you rank need for project? High to low priority. Does application address the need for project? Answer: the project is designed to enhance, not duplicate, Lexington's existing health and community efforts by providing the enabling infrastructure, connectivity, devices, skills, and navigation that increases residents' ability to use existing services effectively. It does not replicate Lafayette Regional Health Center clinical services. It improves access, follow-through, and linkage to appropriate care. We rank the need as high priority because digital access is a cross-cutting barrier that affects physical health, mental health, and social well-being simultaneously. Our documented wait list of 7 households confirms immediate demand. This proposal directly addresses the need by delivering concrete resources plus wraparound supports and measurable outcomes. Question: is application from a city department that has a separate budget/funding from City of Lexington? Answer: no. Essential Families is an independent 501c3 nonprofit organization, not a city department, requesting funds solely to deliver health and wellness benefits to Lexington residents. Question: are there other funding sources, other entities or organizations helping to fund this project? Answer: this request is the primary funding source for the Lexington cohort. In-kind support is anticipated through local referrals/workshop partners, space for workshops, outreach/referrals, and through Essential Families' existing infrastructure, trained digital case manager network, data systems, and platforms such as No-W Video and Everything KC. If awarded, we will continue building a local co-investment strategy, additional philanthropy, corporate, community partners, to scale beyond 14 households and reduce the wait list. Question: does the project reflect a collaborative effort among several organizations/agencies/city departments? Answer, yes. Implementation is collaborative by design. Essential Families will coordinate with Lexington area referral partners, city/community organizations, health department, schools/library/faith partners as available to identify eligible households and host workshops, while our workforce development collaborators, Full Employment Council, Great Jobs KC, P/Strata, RW2 Cybersecurity, Operation Breakthrough, provide downstream training/employment pathways once households stabilize. This creates a continuum from wellness/stability to sustained employment and economic mobility. Question: how well has project been described, referring to items number 1 through number 6 listed on application form? Answer: the project is described with 1. A clear need statement tied to Lexington wellness outcomes. 2. Defined steps, staffing, and partner roles. 3. A detailed line item budget with per household costs. 4. A sustainability approach, including maintenance/support and transition to affordable internet. 5. An evaluation plan with baseline and monthly KPI reporting. And 6. A concrete public recognition plan for HCA Midwest Division. Question: has this applicant applied previously for funding? If awarded funding for proposal, did applicant turn in required project completion reports, submit receipts if applicable? Did they formally acknowledge HCA Health Midwest with very visible signage? Answer: Essential Families has not previously applied to this Health and Wellness Committee funding opportunity per information provided. If awarded, Essential Families will submit required progress updates and a final completion report, provide copies of invoices/receipts for all equipment purchased with grant funds, and deliver visible acknowledgement of HCA Midwest Division on materials/equipment and public communications as specified by the committee. Question: would the health and wellness funding be better utilized on a larger project which involves more residents, has greater long-term impact and sustainability? Answer: this proposal is intentionally structured as a high accountability, high impact cohort model that can scale. Serving 14 households produces measurable wellness gains quickly while establishing a replicable Lexington delivery pathway, partners, processes, reporting, that can expand in subsequent quarters as additional funds are secured. The long-term impact is strengthened through 1. One-year device support, 2. Transition planning for affordable internet beyond the subsidy period, 3. Telehealth access that reduces delayed care, 4. Workforce partner connections that increase wages, and 5. 5-year tracking, making this an investment that is both immediately beneficial and sustainably scalable. Delivery and timeline. Essential Families will deploy the $50,000 award to serve 14 Lexington households over 12 months using our proven 24 steps to close the digital divide methodology with monthly KPI reporting and on-request dashboard exports available to the Lexington Health and Wellness Committee throughout the project period. Phase 1, Planning and Setup, months 1 to 2. We will formalize Lexington-based referral and workshop sites, steps 1 to 3, with local partners, for example, city, health department, schools, library, faith/community organizations. Essential Families will recruit/train local digital case manager capacity, step 13, and complete baseline assessments aligned to the Urban Institute's predictors, income/employment status, digital access, housing stability, healthcare access, and education goals. We will configure reporting templates and implement weekly quality assurance testing, step 12, to ensure device readiness, connectivity reliability, and client support responsiveness. Phase 2, Implementation and Service Delivery, months 3 to 8. We will conduct essential economic mobility workshops, steps 14 to 16, distribute new Chromebooks with 1-year premium support, and enroll each household in the best fit internet plan with 6 months of service at no cost. Steps 17 to 20. Digital case managers provide a 48-hour follow-up, then twice monthly check-ins for up to 3 months, plus continued touch points as needed. Steps 21 to 23. Households receive essential telehealth, unlimited primary care, plus up to 5 mental health telehealth sessions, digital safety training, and resource navigation through everything Casey and No W video, including translation. Phase 3, monitoring, evaluation, and reporting, months 1 to 12, ongoing. We will track outputs, households enrolled, devices delivered, connectivity established, training completed, telehealth utilization, and outcomes. Digital skill gains, healthcare access, employment steps, income changes, and stability indicators. Metrics will be disaggregated by age group, household composition, and other equity variables collected at intake. We will calculate community ROI annually and track economic mobility index measures, wage progression, and time to recoup, with 5-year longitudinal follow-up where feasible.